Today's lecture will cover methods to minimize patient dose. The predominant concerns for a radiographer include how to obtain an optimal radiographic image with the lowest possible radiation dose to the patient. The Röntgen is a measure of the amount of radiation intensity in air based on the inverse square law calculation. Rad is a measure of the amount of radiation dose that is absorbed by the patient. The highest dose to the patient occurs at the skin's surface closest to the primary beam. The entrance skin exposure is calculated at the minimum source to object distance, also known as the source to skin distance. We can use the formula MR1 divided by MR2 equals SOD squared divided by SID squared. MR per mass charts can be calculated based on the standard 40 inches of SID. Record an average reading of exposure in MR and then divide by the total mass used. The lumbar spine, hip, and pelvis typically have the highest ESE readings. These areas require high contrast, which requires low kVp, about the 70 to 85 range. Low kVp techniques require increased mass to obtain acceptable density. Some techniques to reduce patient dose include proper positioning to ensure that anatomy is visualized without repeats. Communication is key in order to make sure that patients understand and hold position and they understand directions and breathing instructions. Immobilization helps patients to hold position when they are unable to do so on their own, such as if they are a pediatric patient or if they have an injury. And using high kVp, low mass techniques allows for decreased dose. There is an interrelationship of the prime factors, which can be calculated by the formula mass times kVp squared divided by distance squared. The intensity of the primary beam will vary with a direct relationship with mass, directly with the square of the kVp, and inversely with the square of the distance. A higher kVp will allow for lower mass to be used in order to maintain density. However, increasing kVp also increases scatter and decreases contrast. Selecting the highest kVp consistent with obtaining desired contrast results will help to reduce patient exposure. Some technique charts utilize fixed kVp and vary mass. Typically, these techniques utilize higher kVp and provide lower patient dose. Some technique charts utilize variable kVp and fixed mass. Typically, these techniques utilize lower kVp and higher mass, which results in higher patient dose. This is an example of a fixed kVp chart. The kVp remains constant and mass is varied depending on part thickness. This is an example of a variable kVp chart. The mass remains constant and the kVp is varied depending on part thickness. Mass is directly related to patient dose. When mass is decreased, dose is decreased. To reduce patient dose, mass should be maintained at the lowest possible level. When the longest SID is utilized, the beam is less intense and the entrance skin exposure is decreased. However, mass must be increased at longer distances to maintain density. As SOD increases, entrance skin exposure decreases. As OID increases, the part gets closer to the source of radiation and entrance skin exposure increases. To obtain the lowest possible entrance skin exposure, increase SID, increase SOD, and decrease OID. Increasing filtration decreases entrance skin exposure by absorbing the low energy photons which will be absorbed on the skin surface. Decreasing the field size by using collimation or beam restriction decreases the entrance skin exposure by absorbing the scattered radiation, which does not add to diagnostic quality but does add to dose. This is not always an option if visualizing large areas of the body, such as the chest, pelvis, or abdomen. Lead shields reduce dose to the gonads, thyroid gland, and other areas of the body when they're used appropriately. Shields must be positioned very carefully so pertinent anatomy is not obscured. Grids clean up scatter, which degrades image quality. Mass must be increased to compensate for the loss of the density that would have been created by scatter. The use of grids increases patient dose due to the need to increase mass to maintain density. Lower relative speed can be utilized to increase detail, but requires more patient dose due to increased mass needed. A higher relative speed can be utilized to reduce patient dose. Digital receptors can respond to a wide range of exposures. Extremely low or high exposures do not produce acceptable image quality. The appropriate mass, kVp, and SID must be chosen in order to obtain an optimal image with the lowest possible dose to the patient. A higher exposure is sometimes necessary to achieve higher image quality. An example of this would be the use of a grid for increased contrast, or the use of lower relative speed for increased detail. It is the job of the radiographer to ensure the patient has the proper images performed to make an accurate diagnosis. To maximize diagnostic information, provide a brief yet thorough description of patient history. This may include symptoms, how long the symptoms have existed, the specific area of symptoms, and anything that may have induced or aggravated the symptoms, such as an injury, an eating habit, or movement. In summary, the patient has the right to refuse any diagnostic x-rays. It is crucial for the radiographers to work with the ordering physicians to provide enough information about the exam for the patient to make an informed decision. It all comes down to, does the benefit of the exam outweigh the risk of the exposure?